All right, good afternoon, everyone. Happy New Year. Thanks for joining us today and for giving us a week reprieve last week. I hope you had a great holiday and stayed safe and had a good time with friends and family in a safe fashion. This afternoon, today, much of our focus will be talking about what's going on with vaccinations and what's happening with the vaccination rollout. So I'm going to leave all that to our healthcare partners. I'll just take a couple minutes to review some of the data of where we sit today and kind of a little bit of a background on kind of why we're maybe seeing what we're seeing. I think what you'll see with the data probably should also include a thank you to our community for the work they've done with the mitigation and diligence to that mitigation, because it's showing in our numbers, and it's showing in what we're seeing with our case counts and our hospitalization. So I think I might have just skipped past one there. So let me go back one. There we go. So where we sit today, we actually had a very low case count today, only 18. So that is in fact accurate. The 288 was some combined total that came with the holidays there. So continued downward trend you see in our number of daily cases. That's also then leading to we're kind of in a valley right now with our active case counts. Those active case counts are just under 2,000, up from a high of 4 weeks ago from close to 5,000. So you notice that this week I'm showing 4 weeks worth of data instead of 2 to kind of give a look for what happened through the month of December. And so pretty dramatic decrease in the number of active cases, a lot of people recovering, a lot of people being discharged from our healthcare providers as a result of that, and you see that reflected in the hospitalization numbers as well. So hospitalization numbers have also, I would say, plateaued a little bit. If you look at really the last week and a half to 2 weeks, right around that 90 to 100 mark between both Vera McKinnon and Sanford Health. Again, down from at the beginning of the month closer to 180, 190 in there. So about a 50% decrease in the hospitalization. So those are good trends. Those trends, like I said, I think are due to a variety of reasons, one of which is just smart actions by our residents. The mask wearing, social distancing, taking it seriously over the holidays. We'll see what happens in the next couple weeks as a result of that. But overall, it just feels like there's been some breathing room that's been put into the community, that's been breathed into our healthcare partners, and also the vaccination information and the news of the vaccination has given some additional breathing room as well. So I'm going to turn over to Dr. Wilde with Sanford. He's going to talk about what's going on with our vaccination rollout efforts and talk a little bit about Group C between him and Dr. Basil, the group that we're currently in with vaccination scheduling. So, Dr. Wilde?
Thanks, Mayor, and good afternoon, everyone, and Happy New Year as well to everyone. Hopefully everyone had a great, safe holiday season, and then can even enjoy the nice day today, which is outstanding. Currently at Sanford, we're sitting with active inpatients with COVID, around 25 to 35 patients, agreeing with the numbers that the mayor showed on the slide. That includes, of that number, there's an additional around 30 patients that are still needing hospitalization but not needing isolation for COVID, but certainly came in with COVID and have had a prolonged hospitalization. The pandemic continues with some better news, but certainly still very significant consequences for those affected, both directly and indirectly. From a vaccine standpoint, we continue to work with federal and state authorities in regard to the allocation of the vaccine. So we receive notification most weeks on a Tuesday as to how much vaccine and of what type, whether it's the Moderna or Pfizer, that we're going to receive. We started, tomorrow will mark 21 days since we started vaccinating at Sanford and Sioux Falls. We continue, as this slide alludes to, we go through a 1A, a 1B, and a 1C, and there's other letters beyond that we continue to work with that list. That list is generated from the ACIP, which is the federal body, in addition to the state, in addition to working with us as healthcare providers, really to, it can get very specific. The categories that we receive tend to be general, just because as they come from the federal level, from the state level, there's roles that we need to identify and then communicate with, and it really does come down to identifying individuals not only that work for Sanford but in the community that we feel need vaccine. And so we reach out to those folks and get them registered, get them through our process to get the vaccine. And people have been very accepting, very accommodating. I think we have a very smooth process, high capacity process. In the last few weeks, we've given out 8,200 vaccinations, and about 3,000 of those have been outside of Sioux Falls, to various counties, not only in the eastern part of the state, but some in the western part of the state as well, as we've worked with the state of South Dakota to identify counties that we might be responsible for, or Avera, or Monument, and other areas as well. So working really close with the state, worked very closely in the past week with the city of Sioux Falls to identify our first responders. I worked with other cities, other counties as well, to identify those first responders that would be eligible to receive vaccine, and got those folks vaccinated as they became eligible as well. So really encouraging folks to get the vaccine as they're eligible. We are finding good safety with the vaccine. For instance, within Sanford, we've administered about 15,000 vaccines and have had 15 patients of those that have needed additional evaluation for side effects from the vaccine. If you look at that compared to what would happen if 15,000 people had COVID, that certainly favors the vaccine and the safety of the vaccine. So please consider that, and we are optimistic that we'll continue to get more supply and get that out to people as it's available. So please consider that. Exactly how you go about getting vaccinated. I know working with Avera, ourselves, other healthcare providers in the state, we're going to be rolling out a website with a lot of information, looking at the safety, the high points of who should get vaccinated when and how you go about that. So we're looking to stand that up very soon. And with that, I think I'll stop and turn it over to Dr. Basil for some further information. Thank you.
Thank you. So first off, I think as South Dakotans, we should be very proud of our state. We are ranking in the top 2 or 3 states nationally on the percentage of the population that we've vaccinated so far, and also in the percentage of the vaccine that we've been allocated and that we physically have, that we've been able to get into arms. We've been very efficient on, as soon as that vaccine comes in, we're getting it given to people, whereas you see national news a lot of times they're saying it's sitting in freezers somewhere. That's not happening in our state, whether that's Sanford, Monument out west, or us with Avera. We're getting it done, and so I think all of us should be proud of that. At Avera specifically, we've also think that we'll pass about 15,000 vaccines given by the end of this week, about 50% of those given throughout the rest of the state, and the other 50% being given in kind of the greater Sioux Falls metro area. Also been seeing very good results as far as tolerability of the vaccine, and no serious adverse events. I think we did have one allergic reaction that we monitored and ended up being just fine. So things have been going very well with vaccine rollout. As far as hospitalizations go, we have dropped to where we're probably less than half our peak of overall COVID hospitalizations compared to what we were around Thanksgiving time. However, kind of like the graph that you showed earlier, we're in a little bit of a valley, so we did kind of level out for a couple weeks. In the last few days, we've seen that started to creep back up again, and we've started seeing our case count start to creep back up again. And so we're watching that closely to see if we are going to see a holiday kind of bounce. We didn't see that after Thanksgiving, and hopefully we don't see much of that after Christmas and New Year's, but we are watching that closely. Also closely watching to see whether this variant strain that you've been hearing about from the UK and other places, whether that's going to reach South Dakota. We don't have any reports that we know of that it's here, but we'll continue to watch that. If you do hear about that variant strain, there's no reason to expect that the current vaccine would not cover it. So we do think the vaccine will cover these variant strains, or if you've been infected before, that immunity from that previous infection should help cover for that variant strain as well. So that's very reassuring as well. Now, another thing with vaccines is that once you've had the vaccine, doesn't give you kind of a get out of COVID free card. You still have to continue to wear your mask, continue to social distance, because we know that it will protect you from getting seriously ill. But because it primes your immune system to fight off when you see it again, that's going to take a little bit of time for you to fight that virus off. And during that time period, you still may be able to transmit it to others. So you still may be contagious during that time period. And so that's why even after you've either had the illness or you've been had a vaccine, you still need to do social distancing and wear a mask. We're continuing to get more data on how contagious individuals might be, and until we get a better picture of that, visitation guidelines at hospitals and at nursing homes and those sorts of things are not going to change in the immediate future. We've got to get enough people vaccinated to get it totally out of our community so that we can open up everything back up again. So with that, I will stop and I think open up for questions.
All right, thank you, doctors. Any questions for myself or either Dr. Basil or Dr. Wilde today? Don?
One point of clarification, Dr. Wilde, you said 8,200 vaccinations so far at Sanford, but then you said something about 15,000.
Yeah, point of clarity in regard to 8,200 doses at Sanford or 15,000. So the 8,200 would be in what we at Sanford consider our south region, which is Sioux Falls, and then the 15,000 would be Sanford as a whole, so across North Dakota, western Minnesota, northwest Iowa.
The 15,000 at Avera would be in South Dakota, you said?
So, yeah, so Avera's given about 12,500 going into this week. We tend to give about another 2,500 this week, so we'll be at about 15,000 by the end of the week in South Dakota only, and about half of that outside of the Sioux Falls metro region. And then we've given it in our other states, but that's separate counting.
That website is a combination of Avera and Sanford and mine all working together to roll out information about the vaccine and when people can get vaccinated. Is that correct?
Right, so the state has a website out there where you can go to a picture of counties on the state, and you can figure out county by county who's responsible for vaccinating within that county. And there's counties like Minnehaha where both Sanford and Avera are sharing the county. And so if you click on the county that you live in, it'll take you to either, if it's an Avera county, it takes you to Avera's COVID website. If it's a Sanford one, it takes you to Sanford and goes from there. So yes.
We're in group 1B.
So from the vaccination group, so group 1A is healthcare workers and frontline healthcare workers. We moved through that. We're in 1B, which is nursing home residents. So then that one's going to take 3 or 4 weeks. We're also in 1C, which is other clinical activities. And so that's where the dentists and the optometrists, all those sorts of individuals come. So we're in both 1B and 1C at this point.
Law enforcement, emergency management.
Yep, absolutely. First responders of all kinds. Yep.
When can the general public expect?
So the general public, we're expecting that within the next few weeks, we'll be moving into 1D, which is a pretty big category. 1D is all of those greater than age 65, those with chronic medical conditions, in education, congregate living settings, and so that's going to be a big group when you've got all of the elderly in there. So that one will probably take a while. And then there's one more group after that, which is essential workers and essential industries. And so for a young, healthy person to get the vaccine, we're still probably looking later into the spring sometime, assuming we continue to have a good amount of vaccine available. The other thing to keep an eye out for is we do anticipate that there'll be 2 more vaccines coming to market within the next 4 to 6 weeks. There's Johnson & Johnson vaccine and AstraZeneca that sometime in February or March we think will be approved, and that should be another whole big shipments of vaccines that becomes available at that point. So that'll speed things along.
So you talked about roughly 2,500 a week these days. Is that relative to what you guys are getting at Stanford as well?
So the question was around numbers being given on a weekly basis. Yes, so 2,500, it's really based on allocation that we receive from the state. So like Avera, as soon as we get it, we give it. And so we'll give it within the week. And it again, based on allocation, we'll give about 2,500 doses if we receive them.
And then South Dakota right now is sitting at the top of, per 100,000 percentage of people getting the vaccine. Why have we been so successful at getting the vaccine out to people? We talk about sometimes they're sitting in freezers for a long time in other states. Why have we been so successful at that?
So the question is, why have we been so successful in getting the vaccine out per capita? Like Dr. Basil alluded to, I'm taking some liberty with your question, but alluded to, we're one of the top performing states. It's a huge thank you to the population that we work with. It's our healthcare workers. Tends to be a little bit of an engaged group. A lot of those are started within Sioux Falls. It's a testament to the resources we have within our healthcare system, our electronic medical record, being able to also identify populations that don't work at Sanford or Avera that also qualify for the vaccine, and frankly, just reaching out to them via email, calls, et cetera, really passionate about moving through the list to get vaccines in people as soon as we possibly can. And that's what the state has asked us to do. We certainly feel obligated to do that, and we've had good traction from those that have become eligible for the vaccine to receive it, and they come in. And I know at Sanford, in our Imaginetics building here in Sioux Falls, we can do 7 vaccinations every 5 minutes, and so we run through people through there pretty quickly in a great facility, and there's been good public capture from that. And then also working with our areas outside of Sioux Falls as well, just to have that streamlined, efficient process, because no one wants to show up and wait in line forever. No one wants to sit there forever, have an uncomfortable experience. So we try to dedicate ourselves to making it as comfortable as possible.
Dr. Allison, can you clarify the website you were referring to? Is that covid.sb.gov for vaccine information?
Yeah, so the state has the covid.southdakota.gov website that you can go and get vaccination information, and takes to things like that map of the county by county state. I'll also maybe comment on why have we been so successful in South Dakota. It's because of partnerships at the city level and at the state level. We're able to cut through the red tape, I think, so much more effectively than a lot of states are. We just get it done, and I think that makes us different than a lot of states nationally.
Trevor.
Change topics a little bit. Tomorrow, the city council will be voting on the second unit for the $100,000 for the COVID-19 public health campaign. Can you talk a little bit about what that money might help with, and partially what that other $20,000 that already went through has gone for?
Great question. So the question was in regards to some funding that the council has asked the administration to consider spending on COVID education campaigns. Right now, the focus of that is going to be towards the vaccine education. And I think when this originally was allocated, the thought was we'd have a public campaign around mask wearing and mitigation and so forth. That ship has kind of sailed, and now we need to educate people on the efficacy of the vaccine, how to get it, where to get it, the fact that there's priorities of people, what those are, FAQs, and so we're going to be working hard to make sure people feel very safe and comfortable with the vaccine, with the science behind the vaccine. In some states and some cities, you've seen leaders in the state taking the vaccines to show their confidence in it. So there'll be some efforts like that where we want to show people that, hey, leaders in our community feel very comfortable with this. So marketing and advertising, which luckily I know a little bit about that from my old days, so we're going to be putting some efforts towards that. The original $20,000 that the council allocated, we still banked that as well. So that will be going towards one comprehensive campaign that we're working on as we speak.
Okay, so none of that has gone out yet.
It has not.
As you
Correct. I think what's really important for the public to know right now is there's no vaccine available for you if you're in the public, and it will be soon. And when that's available, that's when that campaign will be running to make sure people are ready to receive it and excited to receive it. Any other questions for us today? All right. Thanks for joining us today. Have a great rest of your week.